Hi, tonight we're going to be talking about virtual reality as a treatment for social anxiety disorder and how effective that is compared to other techniques like in vivo, which is the real life scenarios to enforce patients with SAD or social anxiety disorder to overcome their avoidance to situations like that. So, what is SAD? SAD is a common mental health disorder, and that happens due to the feeling of worrying about being embarrassed or judged by public in certain situations, and that lead to a level of avoidance from being in situations like that, and can lead to depression, can lead to self-isolation, and sometimes can lead to even suicide. So, to look at how effective VR in the treatment of SAD, we picked up a paper by Bouchard et al., and that was published in 2017 in the British Journal of Psychiatry, and we looked at pages between 276 to 283 from memory. Yeah, that's correct. And the major hypothesis of the paper was that CBT with VR is more effective than CBT with in vivo, and we'll come to know how that become proven through the paper. So why using VR? One is to overcome the limitation of the in vivo when it comes down to privacy concerns and how the patients don't want to be in public places and get to be known to people or exposed. And then it eliminates the need for a medium, which is again the human factor that can be used as an enforcer for situations in public, which can cause an element of fear. And according to patients, that element of fear is reduced significantly by using VR. And one more thing is about customization. VR can be customized to repeat the study and the tests several times to verify the actual results, while using in vivo situation needs a lot of setup and human interaction is huge in that space, and it's not as easy accessed as virtual reality. So what they've done, they got a sample of people, referred to them by GPs, into three different groups. Group one, which is the CBT with virtual reality, and that had 17 patients. CBT, the second group was CBT with in vivo, which was 22 patients. And the last one, what they called it, the waiting list group, which had 20 people. And there was a pre-assessment, a post-assessment, and there was a follow-up after 6 months for all these groups. And there were a number of scales that we used, like for diagnostic purposes, like DSM-5, and another level of assessment that happened based on the level of phobias across the sample, using different scales like SIAS, which is the Social Interaction Anxiety Scale. And that was primarily the sample that they started with. So the therapy or the method of how this was conducted was based on in vivo, which is the real life scenario in a coffee shop. And the person would be with someone who would ask inappropriate questions to the coffee shop staff, something to be embarrassing, or they would be wearing something that's really funny that causes people to look at, and someone would be recording these scenarios. In virtual reality, they would be in a room and they would be wearing head-mounted units connected to motion trackers and be exposed to scenarios like job interviews or someone persistent to sell you something, and that all be tracked. So the outcome of that showed that there is a significant difference and decrease in the fear factor and the SAD elements in this between the two groups, the CBT groups and the waiting list group, and that was clear and obvious. However, the difference between the two CBT groups was not huge, and that was measured by all the figures and tables showed that, and which cannot be displayed in this short presentation. However, based on the hypothesis of the paper and the effectiveness of CBT using virtual reality, it's proven that it's effective, but in difference between groups which were not exposed to any treatment and the groups were using virtual reality. In vivo, there was a difference, but not huge. And even that difference was still showing after 6 months follow-up between the two groups that were treated. Looking at the conclusion of this study or this paper, the paper listed a number of limitations as part of the study, which is some of them were due to the lack of independent assessing individuals and the size of the sample. And they were talking about maybe in the future they can use group samples. And I look at that and I see there is a number of hypotheses, the number of elements that were missing from the paper. First one is they only used one hypothesis, which is the effectiveness of virtual reality versus in vivo. And again, the nature of the sample. It lacked the gender and the social background and the educational level. And then they applied the same scenarios for female and male, which there is a difference in fear factor between the two groups. And the interval of the follow-ups, it could happen 3 months instead of 6 months or later on. Thank you.